Thank you, Madam Deputy Speaker. I will try and keep my remarks brief. The NHS is one of the single most unifying institutions in our country today. It's a huge employer, a major source of pride and a safety net for us all at our moments of greatest need. But we all know that it has been creaking under significant strain for some time now, so it is good to see new life and new energy in the 10-year plan, and I welcome this NHS Bill as a response to some of the purpose outlined in the strategy. There is a lot of detail in the bill that has been covered by colleagues already and will doubtless be covered further in Bill Committee, so I will limit my remarks to single patient records and the role of public health in this bill. Firstly, I am fully supportive of a single patient record finally being realised. Our health and care system should revolve around patients rather than patients revolving around it. It is over 20 years since I was a junior doctor, but I still remember mine and my patients' frustration when I once again had to ask them for their clinical history after they had already told it to their GP, the paramedic and the triage nurse. This endeavour has been tried several times before. The financial cost of NHS Digital and the litany of platforms, software and systems that have been tried and abandoned provide a wealth of lessons learnt to ensure that it is successful this time, which is, let's face it, long overdue. Public trust is very important for health data systems, and we could consider new safeguards such as a public interest test for sharing data or bringing back requirements to report to Parliament. The NHS must ensure that the technical know-how is sound as well as being fleet of foot. To the role of public and population health in this NHS Bill. Public health must be front and centre in order to provide the right health services in the right place at the right time. At an ICB level, an Integrated Care Board level, there is now an explicit requirement for population health considerations to be understood. Integrated Care Boards will be responsible for commissioning the vast majority of our local NHS services and therefore need to know what the population health need is. This has been demonstrated in my own ICB area of Sussex over the past couple of weeks. In the discussions about proposed sites for neighbourhood health hubs, it became clear that the population needs of my particular constituency in Worthing West had not been entirely understood when considering sites. There is a large area containing several villages with an ageing population and limited access to transport that had not hit their radar in terms of neighbourhood health hub requirements. And to be clear, this is not about blame. Anyone who thinks that planning for population health needs is straightforward is very welcome to sit the public health exams in epidemiology and statistics. Expertise is there to be utilised and we should draw on it. I therefore suggest that we should make a statutory appointment for a lead director of public health to represent the area covered by each integrated care board. Finally, in order to guard against a focus solely on reorganisation, we must have, sitting alongside this NHS Bill and as a key focus of the 10-year strategy, a whole government approach that recognises health as a strategic and shared asset for the well-being.